In today's video, this is going to be for Nursing Lab. This video is going to demonstrate how to transfer a patient from bedside to wheelchair. This isn't a wheelchair, but we'll pretend that it is. So to begin, we're going to pretend to lock the bed in place. There'd be railing right here on the bedside, so lock the bed in place to ensure that the patient is safe. And then we're going to place our wheelchair bedside, and it's going to be at a 45-degree angle. And so, but before I begin, I'm going to say my name and introduce myself to my patient. So, hi, my name is Josh First. I'm a sophomore nursing major at Cedarville, and I'll be taking care of you today. Can I have your name and date of birth?
Yes, my name is Jornet First. This handsome nurse mom, and my date of birth is October 11, 1969.
All right. So now that you know your patient, you're going to go ahead and wash up, and you should wash up. That's the first thing that you should do. And so the first step is assisting your patient in the sitting position and before transferring them to the wheelchair. So first, we're going to have the patient get on their side. So her strong side is her left side. So she's going to turn on her side, and she's going to bend her elbow and pivot upward, pushing her body. And so we'll go ahead and help her up. And then as she's coming up, we're going to turn her legs on the outside of the bed, and we're going to let her dangle. And this is just a time that she can sit and get used to sitting because she's been laying for a long period of time. So she's going to sit here until she's comfortable, until we can move her and stand her up to get to the wheelchair. Now that our patient is in the dangling position and she's sitting upright and she's comfortable, and acclimated to sitting up after laying down for a long period of time, we went ahead and grabbed her some non-slip socks or some non-slip shoes just to ensure that she doesn't slip or fall once we transfer her to the wheelchair. Next, we're going to grab the safety belt, and we're going to go ahead and put it around our patient and put it around the waist. Okay. And so now that the safety belt is on, I'm going to go ahead and get to the side of my patient and put my arm around her back. And so now we're going to count to 3, and I'm going to gently rock her, and on 3 we're going to step into the ground. 1, 2, 3. And so now I'm going to be slightly in front of her and making sure she's balanced and stable, and I'm going to be at the side of her. And now with her strong hand, which is going to be her left hand, she's going to go ahead and put it on the rail of the chair. I'm slowly going to ease her onto the chair. And make sure there are no pressure points on the chair. For example, if she has a lack of blood flow or circulatory problems, we want to make sure for pressure points on the chair so we don't obstruct blood flow.